Alberta Primetime with Michael Higgins.
Welcome to Alberta Primetime. Ahead tonight, our politics panel on a petition pushing back against the funding of private schools falling short. But first, pressure of another sort on politicians.
Alberta wants to create a private health insurance market and drive up costs like in the U.S. Bill 11 will increase wait times in public sector, and it opens the door to hospital user fees. It is truly a disaster for public health care.
Public health care advocates on Parliament Hill this week urging MPs to take a stance on Alberta legislation that aims to expand private health care in the province. Legislation, they say, violates the Canada Health Act. And joining us now, Chris Galloway, Executive Director of Friends of Medicare. Mr. Galloway, good to see you again, sir.
Hi, Michael. Thanks for having me back today.
Okay, and you are just back from Ottawa. You're back in the province. You were we saw you there, part of that coalition meeting with something like 100 MPs, senators as well. What was your message in a nutshell?
Absolutely. We were there along with the Canadian Health Coalition and hundreds of folks from all across the country, including 32 Albertans from 23 different constituencies. And we were meeting with senators and MPs from all parties. And the biggest message of that lobby was the federal government needs to act on what's happening here in Alberta. That Bill 11 is an existential threat to public health care in Canada, that the federal government has very clear responsibilities for enforcing that act, and that they need to speak up and start to act on what's happening, because it won't just impact Alberta, but the whole country if this is allowed to happen, this two-tier American-style healthcare, but also the potential of undermining trade agreements while allowing American insurance companies into Alberta and so on. So really hammering home the point in Ottawa that there's federal responsibility here, and that after months of silence, we're expecting them to speak up and act.
Okay, Bill 11, it's the focal point. Many Albertans already know. Legislation passed by the Smith government in the last sitting that will allow doctors to work both public and private health settings. Put perspective on why you feel that is worrisome.
Well, it's a very clear violation of the Canada Health Act. So in terms of the federal government, they have a responsibility to enforce that act, to administer it, the funds associated with it, the billions of dollars we receive to ensure public access to healthcare across the country. So we need them to step on that. But in terms of the legislation, it's very blatantly clear that it's two-tier healthcare, that those who have the financial resources will be able to pay to skip the queue, get quicker care, and the rest of us will be left waiting longer or going without, because right now we don't have the workforce for two systems. Allowing people to work in both systems at once will automatically make a profit motive that ensures that those who can, with the resources and the money, will get care quicker. And we think that's unfair and a very blatant violation of the Canada Health Act and the value of Canadian Medicare and equal access.
Why do you feel the Alberta government would risk violating the Canada Health Act? Why push that boundary?
I think this is their goal, is to set up two systems to get rid of our single-payer healthcare in Canada. It's an ideological choice that they always think private is better, even as things like DynaLife and their lab privatization or the surgical initiative have actually made things worse while costing us more. They constantly come forward claiming by doing this, we're going to save money, we're going to shorten wait times and increase capacity. But once they put these things in place, none of those claims have come true in the last few years. And there's Auditor General reports and other evidence that shows, including the government's own evidence on surgeries, that show that this doesn't work and it won't work. But they're pushing it forward anyways because it's an ideological choice.
How do you see the insurance industry factoring into the conversation?
We see Bill 11 as a gift to the insurance industry. They're bragging that they're at the table with the government to help implement this legislation. And right now, under trade agreements with the United States and others, we have protections for single-payer public health care built into those agreements. If Alberta willingly allows American insurance companies into our province to ensure services that are medically necessary and already covered under our public plan, what does that mean for Alberta and the rest of the country once those corporations are in our country, operating, having legal standing? We need the federal government especially to look at trade agreements and the impacts of this legislation, because we're opening the floodgate to the Americanization of our healthcare system without much of a debate.
Okay, so maybe on that point, how close then do you feel Alberta is to crossing that threshold to American-style healthcare?
We're very worried that we're very close. We're waiting for the regulations and the implementation plan. But once we open that door, it may be impossible to close it and push back. So we're really in a crucial moment. And that's why we were in Ottawa with folks from across the country. And that's why we're touring the province, having town halls, because this is the moment that we need to have that debate. Do Albertans and Canadians want two-tier private healthcare, or do they want to keep our single-payer universal system? And that's the choice in front of us, and it's coming quickly at us. So we need to have that conversation, and we need to see federal leadership, and we need to see Albertans and Canadians speaking up if that's not what they want.
Okay, so then let's cycle back to where we started. Were you able to meet with the health minister? To what degree is the Carney government prepared to engage with you on this?
Yeah, unfortunately, the federal health minister has been missing in action. She's hardly spoken up. She hasn't taken a stance on this legislation in Alberta. We did meet with many members of the Liberal government and all parties on Parliament Hill and senators. We saw questions asked in question period and in the Senate specifically to enforcing the Canada Health Act. So I think our point was made and it was clear, but we're still waiting to hear directly from the federal health minister, who has had time to meet with the private insurance lobby. And we think it's unacceptable that she's not meeting with all stakeholders, including those who support public health care.
Okay, and of the MPs you met with, were you able to meet with any who represent Alberta, be they either Liberal or Conservative? And how receptive, if you did meet with them, how receptive were they to your message?
Yeah, we met with parties with MPs from all three parties in Alberta. There's an NDP MP, Liberal and Conservative, and we did have meetings with folks from all of them. We had people from 23 different constituencies, and most MPs met with their local constituents if they were in town. And they were receptive. There was a lot of education needed. A lot of people saying, why are you here? This isn't really a federal issue. It's more a provincial thing. And so really trying to make it clear to them the federal role in healthcare, how there's a key role for the federal government was important. And we had really good conversations about that while we're there. And there's more work to do in the weeks ahead. All
right. We'll have to leave it there for time. Appreciate your time as always, Mr. Galloway. Thank you, sir.
Great. Thanks so much.
Chris Galloway, Executive Director of Friends of Medicare. From Alberta legislation under pressure on Parliament Hill to a petition on education funding falling short and a vote to nullify Trump tariffs targeting Canada. Time now for tonight's politics panel. And joining us this evening, Kathy Kerr, freelance writer and editor, longtime Alberta print journalist, and Dave Cournoyer, Alberta politics writer at the website daveberta.ca. Good evening to you both. And let's begin with public health advocates working the halls of Parliament Hill this week to raise concern over legislation passed by the Smith government that will allow doctors to work in both public and private health systems. Kathy, we heard from Chris Galloway, Friends of Medicare, they're off the top. Surprised to see Bill 11 triggering this degree of concern over the future of public health on a national scale?
Not surprised. Not surprised at all, in fact. I think that whenever questions about two-tier opting in, opting out, working in both private and public comes up related to doctors, it becomes national news for good reason, because it does automatically rope in the whole question about the Canada Health Act and whether or not we are going to continue to have universal public health care. So it is, as he put it, an existential question. And if Alberta goes this way, of course, every province is going to start taking a look at it, because we're all under the same pressure. And of course, the other issue is if, in fact, as Friends of Medicare suggests, you start to see American insurance companies in one province, it would be pretty tough to keep them out of other.
So Dave, how do you see this level of concern landing with the Carney government, especially considering it didn't appear that they received that requested audience with the federal health minister?
Yeah, I mean, this is a bit of a delicate issue for the federal Liberals, for Mark Carney in particular. I mean, we've seen a warming and actively trying to warm the relationship between the federal government in Ottawa and the provincial government in Alberta, between Mark Carney and Danielle Smith. We had the memorandum of understanding on the electricity grid and on potential pipeline construction last year, which seemed to mark a bit of a turning point in that kind of ongoing fraught relationship that really cooled and got pretty cold between the provincial government in Alberta and the federal government in Ottawa when Justin Trudeau was Prime Minister. So I mean, this is a potentially tricky issue for Mark Carney. But when it comes down to the federal government's role in healthcare, I mean, the provinces run the healthcare system. They do the operations side, most of the funding. But when it comes to enforcing public health care and enforcing the principles of and the written word of the Canada Health Act, that's really where the federal government plays a really important role. And there's no doubt that the Alberta government, the UCP, is trying to crack the door open or throw it open wide even to two-tier Americanized healthcare. We saw this with the creation, with the allowing of dual practice and the push towards private surgical centers, and we're seeing it now with the potential opening of a market for private insurance, which is quite troubling because, as was said in the interview with Chris Galloway, I mean, once you open the door to private insurance and these kind of private, very predatory private insurance companies that can move in from the United States, because of the trade agreements we have with the United States, it's going to be very hard, if not impossible, to keep them from expanding once they get into the market. So this is where Ottawa plays a really important role in terms of enforcing the Canada Health Act to make sure that public dollars aren't being unnecessarily diverted to private for-profit clinics, and that the role of public health insurance is preserved, because Canadians from coast to coast depend on it.
So, Kathy, how much of a green light is it then for the Smith government to continue pursuit of private health care, if it is that the federal government does not push back where the Canada Health Act is concerned?
Okay, that's a really good question. And I think what we should consider is that it appears that the Carney government tends to do things, we suspect, behind the scenes rather than out in the public. So when you get a lobby group there, if the lobby group gets to meet with the minister and the minister says something that riles up the provincial government, you're in the fight, especially with the Alberta government, which takes offense at everything. But we know that there's also perhaps more of a back channel going on between Ottawa and Alberta. So we saw that with the MOU, which sort of zinged in out of nowhere in terms of how much detail was in it when it finally hit the public. So there might be something going on behind the scenes. I don't think that the Alberta government is going to work up a fast run of all the regulations to throw these doors wide open immediately, because it has some investment in not having to fight this battle right now when it's got so many other issues to deal with.
All right. Next up for us, a citizen-led referendum petition pushing for the province to end the practice of allocating public funds for private schools has fallen short this week.
A good number of the people that we encountered out in public, the ones that weren't seeking us out, when we asked them the question, they were surprised, and that was a common conversation among canvassers. They couldn't believe how many people in the general public aren't aware of this issue.
Alicia Taylor says more than 123,000 Albertans signed the petition, but it falls short of the more than 177,000 needed to move the process forward. She says more than 2,000 volunteers helped with the effort, hopes they will continue advocating for reduced funding to private schools. Dave, to punch above 120,000 signatures, should that be enough to make the government sit up and take notice?
Well, I mean, the petition didn't meet the threshold that the legislation requires, the law requires, to trigger a province-wide referendum, which is the 177,000. But 123,000 is still a lot of signatures. That's a lot of people. Remember, these are in-person or signatures that are collected in person. This isn't an online website or email petition campaign. So, 123,000 is nothing to that shouldn't be downplayed, is what I'm saying. But that said, I mean, this campaign didn't reach the 177,000 shows that reaching 177,000 is a really hard number. This is a really high threshold to reach, and it's even with 2,000 volunteers, they weren't able to reach that. So 123,000 is a lot, and it's something that the government, even if it doesn't trigger a province-wide referendum on this issue, it's definitely something that the government, both their MLAs, both on the opposition and the government side should take seriously and should take notice for, because that is a lot of Albertans who signed this petition.
Kathy, does this petition not reaching that threshold, is that something the Smith government ends up pointing to as justification for even more funding for private education, expanding that element?
I think they will probably gloss over it a bit because that is a lot, and they know it is a lot. I don't think they could completely ignore it. I think what we're going to see is a heavy campaign from the provincial government about the what is a core issue for them, which is choice, the whole move towards a voucher system in education where money follows the student no matter where they're going, whether public or private. I think we're going to see a really heavy-duty campaign from the government, both from Smith and from marketing in the government, to promote the reasons why they feel that it is important that the private schools gets funding and that there be choice in that selection for parents. So I think that's going to be the effect in the end. I don't think it will affect their current policy very much, frankly, because I don't think they've got money to give them 100%. And so I think 70%, which is pretty generous, I think will probably remain. I don't think they're going to reconsider. I think they're just going to try and sell us harder on it.
All right. Time for us to take a bit of a break. But when we come back, wavering support for the Trump trade agenda where Canada is concerned. More from our politics panel in a moment. Welcome back. Some interesting political dynamics south of the border. 6 House Republicans broke rank Wednesday evening, joining Democrats in an attempt to block Trump tariffs on Canada.
Are these tariffs hurting your constituents?
Yes, absolutely. I've heard clearly from small and large manufacturers as well as agricultural producers that these tariffs are hurting them.
The U.S. House voted 219 to 211 in favor of a resolution aimed at terminating the fentanyl emergency invoked last year, imposing tariffs on Canadian imports. The vote, though, it's largely symbolic as the U.S. president can veto it. In response, Donald Trump posting to social media, Canada has taken advantage of the United States on trade for many years. They are among the worst in the world to deal with, especially as it relates to our northern border. Tariffs make a win for us easy. All right, so Kathy, Trump veto or not, how much of a win should Canadians consider this?
Well, it's not really a win, but at least it's a crack in the wall. And from cracks, you could have a whole chasm open up if Canada's lucky. I think that it's a signal to the Trump administration that they need to come up, if they really, really want to continue this sort of insane tariff policy, that they really need to come up with an entirely different justification for it than the fentanyl crisis, which was always a highly spurious issue in the first place. And I don't put it past them. I mean, they can string this out till the fall with more and more, things that are within the executive branch purview to keep it on. I do think it's a bit of a win from Canada in the sense that it was pretty clear that it was very specifically the tariff relationship with Canada that caused this crack. Because that's where the biggest effect is happening for particularly northern states. So I think that there's a continuing, an increasing feeling there that a lot of this doesn't make sense, not worth the bad feelings, and what it's creating essentially is back strengthening Canada's trade relationship with other countries. So something has to be done soon if they want to keep us basically as the biggest trading partner.
Dave, not surprising that this development would cause lots of political turmoil south of the border. But up here in Canada, surprised there hasn't been more of a Canadian political reaction to this, or from where the federal government stands, is there strategy in letting it be?
I think I think there's probably, I mean, Kathy mentioned in the previous segment about how this government the federal government tends to use under Mark Carney's leadership as Prime Minister, there tends to be a lot of back-channel discussions, back-channel negotiations and back-channel communications happening. And I suspect there's probably a lot of back-channel discussions happening between the federal government and what's happening and the White House and the federal government in Washington, as well as directly with members of the House of Representatives and members of the United States Senate. And those locally elected politicians in the United States, as we saw in the interview with Representative Hurd, they're hearing from their constituents who are, they're seeing the cost of these tariffs because, I mean, Donald Trump has this fantasy that Canadians are paying the tariffs on goods that we're exporting to the United States, but it's American consumers and American businesses who are paying those tariffs. And I think that that's probably the big reason why we saw those 6 Republican congressmen move over and vote with the Democrats on this issue. And I mean, we're going into election season. Or pardon me, we're not going to election season. The Americans are going into election season, into the fall, midterm elections for their House of Representatives and Senate. And I wouldn't be surprised if tariffs become an issue in some districts and some states. That could be a deciding factor in which way the vote swings and who controls the legislative branch. I'd say it's nice to see the legislative branch of the United States actually flex a bit of muscle and actually show a little bit of backbone to Donald Trump, because he's so far been able to just run roughshod over them since he went back into office in 2025.
Kathy, so, maybe crickets from the federal government, but Danielle Smith was fairly quick to post something to social media, sending thanks to U.S. lawmakers for how that vote turned out. And in that same post, she states Alberta looks forward to working with Congress and the U.S. administration towards a tariff-free future between our two great nations. How much of a win is there here for the Alberta government's efforts in continually sending MLAs, cabinet ministers, south of the border over the past year as envoys of sorts?
Well, I mean, she's going to claim that we've been down there and we've been, busy talking about what wonderful trading partners we are. True enough, but does that really have an effect in terms of how anybody votes in the House of Representatives? Probably not. I think the representative who talked about his constituents complaining that they were losing money has more to do with it. It's interesting to me that one of the Republicans that broke ranks is from Kentucky. This is bourbon politics, clearly. He doesn't want to see this wall at the border related to Kentucky bourbon. So I think that seriously, this is about self-interest more than it is about diplomacy from a province in Canada.
All right, Dave, last 30 seconds or so to you. Where do you feel all these developments leave Team Canada dynamics in dealing with the Trump administration?
I think Donald Trump is still unstable and unpredictable and posting on social media at all hours of the night. I don't know if this actually changes anything. I mean, maybe the focus of his anger will be towards these 6 Republicans who voted against the tariffs, but I don't know if this really changes much.
All right. We'll have to leave it there for time. Great to see you both. Thank you kindly for this. Now, here are a few responses to a recent story posted by CTV News, and it's on that topic we just talked about on the panel. The U.S. House of Representatives voting against Donald Trump's tariffs on Canadian goods, including 6 Republican lawmakers. Ron says, finally, some politicians who found some nerve to make the right decision. It's a small start. Wing writes, it's not enough to overrule a presidential veto. Valley thinks it should have been unanimous on both sides of the aisle. Private says, tariffs or not, I won't be buying American. The damage has been done. And Ja writes, the tariffs are hurting American consumers. Have your say. email us anytime at comments@albertaprimetime.com. Coming up tomorrow, in the wake of polling on support for secession, comes a survey on where Canadians land on the likelihood of the U.S. supporting Alberta separation. Pollster Nick Nanos brings us that on Friday. Until then, have a great evening, everyone, from all of us at Alberta Primetime. Thank you for watching, and join us again next time.